The Aged Care On-Site Pharmacist program, or ACOP, is a government-funded initiative that places a qualified pharmacist directly into residential aged care homes. The real benefit of having an ACOP is they become part of the care team, working regularly on site to support safer medication use, improve communications, and resident-centred care.
The role is very malleable. What I really loved about the job was the ability to work not only with the staff, but often I'll go and visit the residents during ward rounds that we'll conduct every Wednesday, look at what the patients need, their understanding of their medications, and whether they have any specific concerns about that.
By having an ACOP on site when we have a new resident, it's part of the process that they get to meet Arnev in person and develop a relationship. And then over time we can go back and discuss their medications, what their desired outcomes are.
From a GP point of view, it's brilliant. In the aged care, they're often on a lot more risk of getting adverse drug reactions. So it's great having the conversation between a GP and a pharmacist, and more time also with each resident to do a good thorough medication review.
We've really noticed that residents are more informed about the medications that they're taking. They're more informed about medications that are being prescribed for them, and Arnev is able to help us with this by looking at ways of reducing our medication burden on the resident so that we're trying to see how many we can reduce. We're looking at the reduction of PPIs where possible, and we're looking at administration times to see if we can reduce the number of those. We feel so lucky that we've been one of the first to be able to have an ACOP on site. Having Arnev as part of our team empowers us to be better nurses. It gives us confidence to raise issues and ask questions that normally we wouldn't have the opportunity to.
ACOP has also offered lots of education to our nursing staff and also been a great help to doctors to do our job when it comes to issues that pop up with our aged care residents.
Working with the GPs has been great. Being able to learn from them more in a diagnostic picture has really helped, but also being able to provide my insights into medication management, which has at the same time really helped me sharpen up my knowledge as well. The future of ACOP is very bright. We all know wherever a medication is prescribed, pharmacists should be at the centre of dealing with and providing care around medication management.
I'd highly recommend the ACOP program. He's just embedded himself in our little family in our aged care facility, so much so that we couldn't do our job without him now. He's a key member.
So having the ACOP program here in Lorne has not only empowered us as nurses, but it's kept our residents informed, our families connected, and our GP team across everything that's happening with the medications.
Western Victoria Primary Health Network is proud to support this important program, and together we can make a meaningful difference to the lives of people living in aged care.